So real quick, I'm sitting in the garage at work before I clock in because I got to clock in just a few minutes, okay? I don't think we talk enough about what it's like to be a black girl in nursing, especially if you're a black girl in critical care spaces, okay? Like me, I've been a nurse for 5 years. I came in at the beginning of the pandemic. I landed my job 6 months before I graduated, which was pandemic wasn't even a thing, okay? Pandemic hit as I was leaving nursing school. The very first job I had, I was a neuro ICU nurse with cross training to surgical and transplant ICU. The manager refused flat out to hire. She did not want to hire me for nothing. She kept trying to talk me out of it. It's so fast paced, it's this, it's that. I don't think you would be able to handle it. All these other things, just to find out that another student that I was with when we was in nursing school got hired on at the exact same unit. And I only knew that because when we went to orientation, she was sitting there right next to me and said, no, she never said that to me. The same way when I was wanting to work P, which I'm in Peds now, but the old hospital I worked at, I wanted to work Peds. They kept saying, we don't hire new grads, we don't hire new grads, we don't hire new grads. And 3 of my white counterparts walked straight into NICU and pediatric ICU positions, okay? This is what I'm talking about. This is the gatekeep that comes with trying to be a black girl in a space that is not meant for you, that is not that you don't fit the aesthetic of the unit, okay? And again, I'm not saying if this is a current situation, because it's not, but in my experience, this is the things that have been happening. And then when you get into these spaces, it's a mean girl environment. They want to try to drive you out. They want to try to make it hard for you. They want to try to limit your education and the things that you know, so they can make it seem like you're not competent or you're not up to par. Now, prime example is, as I was on orientation as a brand new baby nurse, they put me with a preceptor who basically she literally verbatim told me, unless you ask me a question, there's nothing that I could tell you. I don't tell you anything. You must ask me. As I'm handling drips and CRT machines. So I basically followed her around for the first few days, and I'm like, well, I don't know what I should be asking. Why don't you just tell me what I need to be asking, or show me what I need to know? And so they finally put me with another preceptor, right? Anyway, they put me with another preceptor, and the experience was just a little bit better, not too much better, but it was a little bit better. Now, what happens is also, what I noticed is that I would get the shittiest of the shittiest assignments. They would throw me to the wolves, but they don't know I got that dog in me. I'm about that bark. I got the bark and the bite to match. I'm a swim before I sink, okay? I'm gonna make sure that I got all the stuff that I need. And if I don't, baby, I know how to look up and ask for help. I know how to figure this out. So I also want to sit there and say that just be mindful of the type of nurse that you're going to be and the type of nurse that you are, especially if you're wanting to get into these spaces like the ED, the ER, whatever you want to call it, ICUs, things like that, because a lot of times it is not meant for you, and they will try to do their best to drive you out. They will do their best to say that you're not being cohesive to the unit, you're not communicating enough, you're not a part of the team, it seems hostile. They watch every single thing you do. You cannot do what they do. If 1 million people are walking around with AirPods in their ears, you cannot. If 1 million people are walking around talking and laughing about their day, cussing and stuff, you cannot, because that is the goal, to get you out. Not every place. I'm just saying, as a generalization, be careful what you say and what you do inside, especially when you know that you know what you know. A lot of times your knowledge will be questioned. People can go behind you about your patients. A lot of times anonymous reports get sent. Just protect yourself and protect your license, okay? And that's all I want to say for all the new nurses that are coming in. If you're a black nurse and you're coming in and you're thinking this is what you want to do, first of all, don't take no for an answer. Second of all, protect your license. Third of all, know that you have all the tools that you need with you, and do some studying outside of work. Look up your hospital's policies and procedures. That way they can't tell you that something is not right when you know you followed it to the T. Okay? Love you. Bye.